Are you having difficulty feeding your loved one who's either homebound or bedbound and they're not thriving? I'm Bienstock, and I'm a board-certified plastic and reconstructive surgeon that specializes in wound care and helping patients who cannot leave the home with their chronic wounds. Many things that I see with my patients due to ethnic and cultural phenomena will deter the patient from gaining weight or being adequately nourished. When someone becomes homebound or bedbound, sometimes their appetite diminishes or they're not getting enough nutrients. This happens with all my patients from all the different boroughs, whether it's Brooklyn, Manhattan, the Bronx, or even Manhattan. What I really tried to push my patients is a more Mediterranean diet and really heavy protein. A lot of meals in different ethnic and different cultural arenas are very carbohydrate heavy. So what I tried to do is not have the families renounce any of their cultural heritage or their dishes, is to focus on high protein foods. This means instead of having a bagel with butter, having bagel with lox and having eggs. Or if you're gonna have kasha, which is a type of dish that's heavy in carbohydrates, throwing in nuts or some other protein. With other Caribbean patients, I make sure they're getting enough meat, chicken, and fish, as well as beans. This is really important. Every meal really should have 2 protein, and we should really minimize carbohydrates and sugars. Most of the material that's in a person's diet when they're homebound and bedbound does have some protein, but it tends to have high carbohydrates and other nutrients that are not really helpful to wound healing. Other supplements that I really recommend, which I'll go over in a future episode, are vitamin C, selenium, zinc, and L-arginine, as well as NAD and NAC. I'll go over the basic science in another video, but really what I've seen is that many of the primary care physicians, the nurses, as well as the nutritionists, don't go over all these fine-tuning things that need to be done for your loved one to thrive in terms of diet.